In classification of snakes, it's divided into elapete, viperete, and hydropete. For elapete, let's make one mnemonic, which is new coke. New coke, N is new means neurotoxic, coke, cobra, and crate. While for viper, V for V means viper is vasotoxic, vasculotoxic. And then third mnemonic is muscle cramp during swimming. Swimming here represents sea snake and muscle cramp is myotoxic. Now we will compare poisonous versus non-poisonous snake. So first of all, on the basis of heads. Generally, poisonous snakes have triangular head, while non-poisonous snakes have oval and elongated head. On the basis of fang marks, on my left side we have venomous snake. You can see two bite marks. The distance between is 1 cm to 0.5 cm, while in case of non-venomous it's semicircular parallel lines. On the basis of pupil, again venomous on my left side, they have elliptical pupil, while non-venomous have round pupil. It's on my right side. And also they have no fangs, while in poisonous snake they have fangs. Now on the basis of tail, like just see below anal plate we can see a row of scales, right? So it is a poisonous snake, while in case of anal plate in the right side we have two rows of scales, right? So this is non-poisonous. On the basis of belly scales, when it is covering the entire body it is poisonous snake, when it is not covering the entire body it is under non-poisonous snakes. Now on the basis of snake, how will you identify? Like for example this. So common people wear spectacles, right? So common cobra have spectacle signs, while king don't wear spectacles, so they don't have spectacle sign. Also you can see 3 number. What it is? It is supraorbital enlargement of the scale. In case of crate, see 4th infraorbital scale is large. In that cobra, 3rd supraorbital scale was large. In this straight band in crate, how to see crate? When there are straight bands, straight rhyming with crate. And in viper we can see diamond scaling. Just imagine V above and V below. What structure it will make? Diamond like, right? So diamond scaling is present in viper. Now in case of sea snake you will identify easily. If the snake is in water, then you can say it's sea snake. Now let's see how to approach snake bite. For example, now suppose a patient came to me and he is saying the snake has bitten him. And I saw the patient and he have local swelling. So it means it is just non-venomous snake. But along with local swelling, if he also have neurological symptom, and I told you the mnemonic new coke, cobra and crate showing neurological, so it can be either crate or cobra. But if local symptoms are absent like swelling, pain, bleb, blister, necrosis, enlarged lymph node compartment syndrome, then it is crate. If local symptom absent, if present, then cobra. See V for V, vasculotoxic is always viper, okay? And when hematological toxicity is there, Russell will always come, okay, along with saw scale viper. But if it is also kidney is involving along with vascular thing, then it is hump nose viper. If kidney, blood and brain is involving, then only Russell, because Russell only involves brain, no other viper involve brain. I told you one mnemonic, new coke, neurotoxic by cobra and crate, also by viper. Just include this thing. And what we will see in CNS manifestation, which is a systemic envenomation, it will start with descending paralysis, bilateral ptosis will be there, diplopia will be there, bulbar muscle weakness will be there, respiratory muscle involvement will be there. Note, recovery will always be in reverse order. Ptosis will be recovered at the last, okay? First lower limb will be recovered. Now vomiting, headache, giddiness may precede as a pre-paralytic stage before the paralysis. Abdominal pain is usual presentation of common crate bite, okay? So if suppose the patient is coming with the early morning weakness, paralysis, don't be mistake as stroke, because it can also because of some snake bite, which is a crate, because you know crate bite is painless and minimal or local symptoms, so don't confuse it with just a stroke. It can be snake bite. Please ask history. Now I told you V for V, vasculotoxics viper. Even the cardiovascular also come in the same category, which is a vasculotoxic, right? So what happened in the cardiovascular? Either there be hypotension, arrhythmia, either ventricular arrhythmia or supraventricular arrhythmia. shock can be there, pulmonary edema can be there. All this come in the category of cardiovascular. Now I told you V for V, which is vasculotoxic or hematological toxic, Russell Viper. Now if it is renal involvement, then I told you Russell and hump-nosed viper, right? So what happened in the renal toxicity? It caused acute interstitial nephritis. If it is also involving muscles, rhabdomyolysis, then it will lead to acute tubular necrosis. See, Russell is the boss. It will involve kidney nephro, neuro brain, blood hemovascular, and also endocrinological. What it will cause in endocrinological? It will lead to direct hemorrhage into the gland, and because of that you will see symptoms of hypoadrenalism, hypopituitarism, even acute shock and hypoglycemia. In Russell you can also see delayed symptoms, like you can see symptoms between 6 months to several years. The patient has bitten by the snake 6 months prior or 1 year prior. Now how to diagnose it? Any snake bite you will diagnose whether it's venomous, non-venomous by the bite, by the head shape, by the envenomation, whether it is involving neurological, hematological, CVS, endocrine. Or what does leukocytosis indicate? It will indicate severe envenomation, whether patient is having anemia, thrombocytopenia, black dark urine, which means hemolysis. So this is one diagnosis. Another diagnosis is about WBC clotting time. So we will take 2 ml blood from the patient as a sample, okay, in a dry glass tube. We will leave it open undisturbed for 20-30 minutes and room temperature. After that, what we will do? Exactly after 20 minutes we will pick up the tube and we will invert it, okay. If solid clot is retained, then it is normal coagulation. But if it is after inversion it failed to coagulate, means it has a coagulopathy. The person has bitten by a snake, the person showing vasculotoxic symptoms. And for cardiovascular toxicity, for arrhythmia or blocks, what we will do? We can see ECG, cardiovascular done by Russell, right? So for that we will do ECG. For kidney or for muscle, for kidney we will do RFT. For muscle we will do CPK enzyme test, okay. For serum electrocyte, ABG, LFT for systemic manifestation. And for urine examination, for proteinuria, hematuria, all those things we will do urine examination. For peripheral smear we can do for fragmented RBC to see like fragmented RBCs, to see microangiopathic hemolysis. And for PTT, APTT, fibrinogen and fibrin degradation products, for that we have to do coagulation screening. For pulmonary edema and for pleural effusion we will do chest x-ray, because these respiratory is involved in the CNS, right, in the neurotoxic. Now how to manage snake bite? So first of all we have right approach, RIGST, reassure the patient, don't mobilize it, immobilize it. Get to nearest hospital and tell doctor about symptoms. And what not to do? Don't suck it, don't put tourniquet, don't put ice pack, don't put herbs or chemicals, and don't do local site incision. Now let's study what does the snake venom contains. Snake venom contains serine protease and other protease. What does it do? What it will do? It will responsible for hemolysis. Protease is pro in breaking RBC, just remember by this. And phospholipase A2, it's responsible for myotoxicity, cardiotoxicity, neurotoxicity and increased vascular permeability. What hyaluronidase will do? It will cause local tissue destruction. Okay. I will do local tissue destruction. Now in case of snake venom, alpha bungarotoxin, it has post-synaptic action which is seen in cobra, while beta bungarotoxin has presynaptic action. It's seen in case of crate. Crate is beta, okay, and pre. Always first then father. Father is cobra. Post synaptic. Alpha sigma alpha male. Okay, cobra is the father, alpha male. Post, it will come after pre. Okay, after crate. Crate is pre. Beta. Now in case of treatment, this is a combination 4 venom. Okay, cobra, crate, then we have Russell viper, and then we have saw-scaled viper. Now this is the mg dosage, okay. It's not important for now, you can read this afterwards. but how you will give like 250 500 ml NS you will give. So this you can study later by pausing it. Now also this ASV, anti-snake venom, when to repeat these dosage when you have progressive or persistent CNS CVS signs or bleeding even after 1 to 2 hours of giving ASV. If you have positive 20-minute WBC test after 6 hours, that coagulopathy wala test which I explained you, then also we have to repeat this anti-snake venom. Now ASV indications, when to give. Obviously when we will see local signs like swollen digits, enlarged tender lymph nodes, swelling extended to wrist or ankles, or systemic envenomation like CNS having ptosis diplopia, CVS sign, arrhythmia or blockage, heart involvement, or kidney is involved, muscle is involved, blood is involved, or coagulopathy is involved, increase APTT, PT, all those things. The role of neostigmine. Neostigmine is inhibitor of cholinesterase enzyme, and so decreases breakdown of acetylcholine, means there will be increase of acetylcholine. It is effective only in cobra bite because cobra venom, that is alpha bungra toxin, has post-synaptic binding right property, so it will only effective in cobra bite. So beta is what? Great. Beta is great, and we will give neostigmine. And what is the role of neostigmine again? By inhibiting acetylcholinesterase, more acetylcholine is available in the synapse, so therefore more of it can bind to the fewer receptors and can better trigger muscular contraction. Thank you.